Hey YouTube, it's been a while since my last video and I wanted to give you guys an update. Pretty much today is February 16th. It's approximately 2:38 p.m. Central Time. I went today for my first consultation with my surgeon. Last time I made a video, I was getting ready to go to my seminar, which I did, and that's where I got all this information that was in here. Today, I actually went down and sat down with my surgeon, and I got this binder filled of goody information as far as the VSG surgery goes. So, when I initially got there, my appointment was at 10:30. I got there about an hour early, and they saw me early, which was kind of good. I got in. It was a $35 copay. I have to still pay that because I forgot my credit card at home. I didn't know what to expect. They got weighed in. I got measured. They took my height first, which I've always been 5'11". For some reason today when they measured me, I was 5'10". I'm shrinking, you guys. I don't know. I'm 38 years old. I'm now shrinking. But I'm 5'10", according to their measurements, and I used a tape measure, whatever, on the scale, with the tracker. Yeah, she's crazy, playing with her daddy with the ball. Then from there, we went in, and I got weighed. I weighed myself at home, and it was like 281, 282. But when I used their scale their scale weighed me in at 285. I'm not complaining about it. It is what it is. So my date pre-op, so we're going to start from now. My pre-op weight is 285. Now, from there, they took my vitals. She took my blood pressure. My blood pressure was 128/88. She said that was good. My O2 was at 100. My pulse was like 80 or between 75 and 80. And from there, the nurse, she was, asking me a couple of questions about my family history and things like that. Then she tells me about some type of bacteria that they have to test for. The first thing that I had to do is I had to breathe into a bag. It was like a blue bag. I breathed in, I took a deep breath, and then I blew into the bag. And then she gave me some lemon water solution to drink. And then 15 minutes after I finished drinking that, I had to blow in the bag again. So while I was waiting for the 15 minutes of that to go by, I went into another room, saw another nurse, and in there they did an ultrasound of my gallbladder, my liver, my kidneys, and things like that, to see if I had any gallstones or anything like that, which everything turned out fine. Then from there, I went into another room. This was like my third room. I went into another room, and in that room, that's when I sat down with Dr. Tudron, who's going to be my surgeon and who I saw at the seminar last month. And in that room, I sat down with him, and he was taking notes in this. I didn't know this book was for me until after, I discussed with him, and the nurse came, the lady who handles the insurance, she came in and she handed me this book, and she went over everything with me as far as what's in the book. But when my surgeon came in and spoke with me, he asked me some physical questions, asked me about my family history again, about the diabetes, high blood pressure, heart problems, if I had any acid reflux or GERD or anything like that. I said no, and things like that. I told him I was placed on high blood pressure pills when my mom passed away in 2013, which I had to be hospitalized for that, but I'm no longer taking high blood pressure pills. Then I got on the examining bed, and I breathed in, breathed out, and then he told me, he asked me what were my thoughts on surgery, and I told him pretty much that me and my husband did discuss this, back when we first got together, and how my husband's mom passed away a year before we met, when she was getting ready to have gastric bypass surgery. And I explained to him the procedure, that she suffered, and he was like, wow, that's, crazy, and things like that. And I told him, I was looking into the gastric bypass up until that point, or the RNY. I told him I looked at I said the gastric bypass seems like a little, you know, too much for me to even think about. And I told him about the lap band, which I did look at, but I said I don't see myself going back in periodically, to get it filled in or whatever. Then I looked at the gastric sleeve, which I think that's more, yeah, it's invasive just like the RNY, but it seems like something that suits me better. And then he, went on and said, we don't do the gastric band anymore, so they discontinued doing that for his facility, and that I would be a excellent candidate for the gastric bypass or the gastric sleeve. So that would be my choice. And I did tell him I do want the sleeve, so he wrote me down for the gastric sleeve. So once I get done with my steps, that's the procedure that I'm going to be taking. Now, my insurance is Blue Cross or Blue Shield, and I get it through my employer, Home Depot. And prior to me even discussing the surgery or even finding out about it, as soon as I got approved for insurance, I called my insurance agent and I asked them, do they cover, gastric surgery, yada, yada. They went to tell me over the phone with a consultation over the phone that, there's a $1,500 deductible. It's a 6-month process, XYZ, blah, blah. So when the Wellstar West Georgia Medical Center surgical coordinator, insurance lady, whatever you want to call her, came in and brought me my binder, she said she contacted the insurance twice. And they told her both times that it's only a 3-month process. So, I already set myself up mentally for 6 months based off of what I found out from calling Blue Cross and Blue Shield. But she said she called them twice and they told her, 3 months. So I'm gonna call them again tomorrow to double, triple, quadruple check to make sure that it is what it is. But in the meantime, here's the binder. It says Metabolic and Bariatric Surgery Guide, Your Solution to Weight Loss Surgery from the West Georgia Medical Center. And in here, in this top corner, it says Accredited Center Quality Program. So we are an accredited facility that I'm going to. The surgery takes place in LaGrange, Georgia, even though I live in Opelika, Alabama. And again, on inside here is my surgeon, his information, and things like that. And how to contact him and the different facilities, and how to contact him for emergency procedures and things like that. The first tab in here is pre-op requirements. And it has my name. It says patient responsibility. So, this is what I have to get done. Or this is my, numbers, whatever. And it says Blue Cross Blue Shield of Ohio, which I'm in Alabama. I don't know, maybe something has to do with where Home Depot is located or whatever. There's nothing written down for the surgery fees. Percentage due by the insurance is 70%. Percentage due by patient, which is 30%. And the office visit copay due by patient is $35. So that's what I had to pay today. The hospital facility fees, yearly deductible amount is $1,500. I haven't met my deductible yet because I haven't been to any doctors or anything like that. Today was my first doctor's visit, with my surgeon. And it says the remaining amount due is $1,500. The insurance pays 70%. I pay 30% or a $300 copay. So I'll be paying $300 copay for the hospital and the hospital facility fees or whatever. And quoted by the insurance, whether or not it's approved or not, is I'm going for the gastric sleeve, not the bypass. So, the next thing in there, on the next page, is actually my to-do list and everything. I have to do everything in order as it is highlighted here. Insurance and the doctor's requirements for bariatric surgery. The first thing was the history and physical, which I got done today with the surgeon himself. This says history and physical, height and weight. This is completed by your visit with the doctor. A complete history and physical must be performed by the bariatric surgeon to include height and weight, which I got done today. The next thing on the list is called a BMI of 40 or higher of a 35 with comorbidity, which I have that apparently today, with the hypertension and things like that. The next thing, the third thing on the list, which I have to contact tomorrow, which is set up an appointment, which will be my first visit with a PCP that I choose in my area. I need to get a PCP letter. Patient must have been previously unsuccessful and with medical treatment or obesity. And they include sample letters of everything in here. Once I get done with the PCP visit, then I can go to the bariatric education workshop, which is a 4-hour class. Prior to doing, after I get the PCP, then I go to the 4-hour workshop. Once I get the 4-hour workshop done, then I go see a nutritionist. And I go to see their nutritionist, which is no charge. So the workshop is no charge. The nutritionist is no charge. After I see the nutritionist, then I go get the psych evaluation. After I get the psych evaluation, the next thing on the list is the 3 consecutive months of supervised weight loss visits. After that, the next thing on the list is not smoking, which I don't smoke cigarettes or anything like that. After that, so she already marked that off on the list, so I don't need to worry about that. After that, then I have to get my blood work done, to which they gave me this list here of every bit of blood work I need to get done as far as labs go. After that, then I need a cardiac clearance. He wants me to get a cardiac clearance, I guess, basically because my mom's, previous heart conditions and things like that. It's not checked off for an EKG. It's not checked off for a sleep study, and it's not checked off for an endo. This thing here, but I do need this done here, which the surgeon will do. And that's where it's an outpatient thing where they stick a tube down my throat. I'm asleep for that, checking, for anything inside. And so that's my to-do list. So first things first is setting up an appointment with a PCP. So I'm going to call my insurance tomorrow on Friday and find out exactly, what do I have to do. Once I get everything on this list done, I fax everything over, or have it faxed over as it's done to my surgeon's office. Then the waiting process begins. Once she has everything faxed in, she says they give it 30 days for the insurance to approve. Sometimes she says it takes 2 days. Sometimes she says it takes up to 4 weeks. So like I said, I gave myself a 6-month process, based off my first phone call when I spoke with someone in my insurance, and I'm going to set this up as soon as I can. The longer it takes, so be it. But the rest of the information in here, they have a section on nutrition, the bariatric surgery progression diet, preparing for surgery, what happens the day of surgery, from discharge from the hospital to day 45, from day 45 to the rest of your life type of instructions. This binder has a lot of information. I mean, it even has my pre-op diet. It has my my liquid diet, my soft diet, my pureed phase. It has everything that I need to know. And she says whatever appointments I go to for post-op, take this binder with me. When I go see the nutritionist, take this binder with me. When I go to the 4-hour class, take the book with me. When I go see my PCP, take the book with me. Take this binder with me every pre-operative visit that I have, so that I know what's going on. And if the physicians that I'm seeing have any questions, I have the book with me so that I can fax over numbers or anything like that. But it's a lot of information, and I'm excited. I'm glad to finally get the ball rolling. And I was nervous going in there today because I wasn't sure if the surgeon would have actually thought that it would be something, you know, that would be an option for me. But yeah, so sorry to make this video so long, but yeah, I wanted to let you guys know what was going on, and I'm on my way to getting VSG. So first step is talking to my PCP, which I have to call tomorrow to set that up, to find out what insurance, what doctor is in my network in my area. So I will talk to you guys after I get step 1 done. Well, it'll be step 2. Step 1, well, step 3. Step 1 was a seminar. Step 2 was a consult. Step 3 will be the PCP. Anyway, guys, I hope you have a blessed weekend, and take care.